Hello and welcome to a breath awareness meditation. As we begin, we'd like for you to take as deep a breath as you can, noticing the sensations in the body as you inhale and exhale. Noticing the movement of your torso, your chest, your abdomen, your shoulders, and any other part of your body. You may notice that only your chest rises. You may notice some tightness or some constriction that makes it difficult to deep breathe. And thus, when we meditate, it is important to create a good pathway for the breath. So, changing your position so that your feet are flat on the floor, sitting up straight and tall, but in a comfortable position, not a rigid position. Maybe moving your back away from the backrest of your chair. Making sure that your head is at eye level, that you're looking straight ahead or slightly down toward the floor, but you don't want to be looking down into your lap, and you don't want to be looking up at the ceiling. You want to have your head at a natural forward position. Roll your shoulders up toward your ears, and then as you exhale, roll them back and down, and let them soften or relax down. This should be a comfortable seated position, creating a good pathway for the breath into and out of your body. And let's try that deep inhalation again. So inhaling, and as you inhale, imagine that you're inhaling air all the way down to your pelvis. This time you should feel not only your chest expand, but also your tummy lift and rise toward the desk or toward whatever is in front of you. And as you exhale, let the tummy soften, let the chest relax down. And let's try that again. So let's inhale nice, deep, as if we're breathing all the way down to the pelvis. And then exhale, releasing air out through the nose and noticing our tummy soften, our chest relax. One more time, inhaling as if we're inhaling all the way to the pelvis. What this does is it fully expands the lungs so that they press against the diaphragm, which rests just below the lungs, and that diaphragm pushes down onto the lower organs, making the tummy push out. And as you exhale, the lungs will recede, letting room back in for those organs, letting the diaphragm lift once more, and then your chest will relax. You can do this anywhere that you like. It is important that you focus your gaze somewhere neutral. So focusing your gaze 2 to 3 feet in front of you on the floor or on a spot on the opposite wall, not on a person, not on an animate object, but something that's still, something that's static, even something that's beautiful. So for this exercise, you could have focused on the Black-Eyed Susans on the screen, or on something, a poster or a picture or a lovely vase or something else. And let's try one more time. So focusing our gaze on a static place, or even better, if you feel comfortable doing so, closing your eyes gently so that there's no distraction, so that you can be fully present in the body as you breathe in. So breathing in nice and deep, and then exhaling back out through the nose. And you can do this anywhere. Waiting in the doctor's office, waiting for an appointment, sitting in traffic, before a test or an exam or a quiz, maybe even while you're waiting in the car before a first date, waiting in the waiting room for a job interview. Anytime when you need a little bit of calm, a little bit of focus, just take 3 deep inhalations and long, slow exhalations through the nose. And that's all there is to it. Thank you for joining me.